Good morning. This is Steve Cleveland coming to you from the Florida Dream Center. And today we have a special guest, Commissioner Charlie Justice. And we're going to talk a little bit about the impact that the COVID virus is having on the community and what the commission is doing to help us, and the partnerships that we have with them and other organizations, and what we can do to make things good in this community. How you doing, Charlie?
I'm doing wonderful. Great to be with you, Steve.
Thank you for being here today. I know you're busy and I know you've got a lot of stuff going on, but one of the things that we'd like to know, what have you seen as a commissioner and actually as a husband and a father of the impact that the COVID-19 is making on us in the community?
How long do we have here?
You got 30 seconds, Charlie.
Well, if you look back, and it's been, 4 months really that we've been really kind of dealing with this. And the first reaction when we started to all hear this was, how is it, personally, am I going to catch it? How do I keep my family safe? And then you start to think about your interactions with your colleagues and your coworkers. And then you keep spanning up. And in the role I play as a county commissioner, we keep thinking about the impacts countywide. From when the president ordered the 15-day slowdown, to when the governor shut down restaurants and bars, to when the governor listed essential businesses, to where the county commission ordered our safer at home instructions, all the way through that, it's had a ripple effect through the community. With the Pinellas being such a retail friendly, being such a restaurant and entertainment district, it impacted us greatly. We lost so many jobs with our restaurants and our servers and our hospitality workers. Our tourism fell through the floor, and we rely on March and April, and that was the worst time of it all. So we saw it all the way through, and that impacts people's real lives and their ability to provide for their families, and it's incredibly serious. On the operational side of the county, we turn the machine on, and our county employees are just incredible. We have the benefit of being in a hurricane zone, in that we have the infrastructure to do that. And our team, our emergency operations team, they flipped it on and they started inventorying all our resources. You have to remember, back when we saw at the beginning of this, and they had some of the models were really terrifying, we started to brace for that kind of impact. Worst case, plan for the worst, And so our team inventoried all the resources that we had. What is our hospital capacity? What is our healthcare capacity? And then flipping to the other side of providing for our families. How can we get food in here? How can we provide services, support for our food banks and our food pantries and the incredible nonprofits in Pinellas like yours that are doing such great work? How can we be a resource? And at the end of the day, probably the most important thing that we can do as a county is provide information to folks so that they can kind of make decisions for how they handle it.
Right.
But so how has it impacted Pinellas? How has it not impacted Pinellas County is really the only question. Like anywhere, but because we are so densely populated, if you were in Lake County, Florida, this might be a little bit different situation, but we are the most densely populated county in a state of nearly 20 million people, and it's going to affect us differently. And probably from the early days, the area I was most concerned with was we have so many long-term care facilities in Pinellas County, whether it's a assisted living facility or a nursing home or a varied use or a senior community 55 and over. That's really where the concern was, because we started hearing about it coming back from Mediterranean cruises and those. So you have a mix, like we saw in Seminole, where you have one building is folks that are well off and doing the traveling, another another building is skilled nursing, and so that's where we saw that first wildfire a little bit. That still is our number one concern, is the long-term care facilities, but really nobody knows how it's going to affect you. And that's, if someone looks you in the eye and says, I know everything there is to know about this virus, you need to walk away from that person, because they're lying to you. We don't know what we don't know.
We don't.
And so we don't know how it's going to affect your DNA versus my DNA.
Correct.
Some people get a mild cough. Some people it gets very severe. And so I know that was a long answer to a quick question, but it's a lot of stuff going on surrounding how we're responding to COVID.
Well, it was, we expected a long answer because there is no short answer to this. And how do you think that we can meet the demand of the spread if it's going to continue to spread, because we're just now coming into what they're calling phase 2. Well, we haven't even got into the winter months yet, where really they thought September and October were going to be worse. So as a father and a husband and somebody just giving me some personal advice, what do you recommend that we do other than wearing our masks and our gloves and when we go out in public? Is there anything else we can do?
Do you remember when this all started? It was people were obsessed with washing their hands for the 20 seconds, and they were singing the songs and all of those. They were Lysoling their doorknobs and things like that. And some of it got a little carried away with Lysoling their food and things like that. But we need to get back to the beginning of this, to where we are very diligent about washing our hands, disinfecting the areas that get repetitive, doorknobs, remote controls, your phone every once in a while, those kind of things. Just be really, really diligent about that. Wear the mask where appropriate. When you're in a business in a crowded, like a Publix, Walgreens kind of place. It's about that kind of. We have to kind of go back. We thought we flattened the curve. When those numbers looked good, we thought we flattened the curve. What we're seeing is we really didn't. It's kind of in a little bit of a second wave, and there's really good hope for vaccines and drugs and treatments. Sooner than we thought. So the idea is to flatten the impact over a longer period of time, so that when you get a dose of this, hopefully you get a mild version and it doesn't affect you as long. And and we flatten that out to where a vaccine is available for the folks that it is going to impact more severely. And so, as my family, we do all those things. We wash our hands, we disinfect, we wear a mask where appropriate.
We have seen through our food bank a 400% increase in food. We were giving out 80,000 pounds a month, and now we're giving out 170,000 pounds of food a month, not including the food that's coming out of here. So how, as a community, do we rally together to move forward?
Well, individually, if you're in a position to help, those are the folks that need to help. So if you have a job, you haven't been impacted financially, you need to step up a little bit more than what you've done in previous years. We are seeing a comeback with our hospitality industry. A lot of those employees are getting hired back. The governor has pushed off foreclosures, those kind of things. That's all. It's not going to be a 10-year master plan. It's got to be immediate triage kind of helping folks. We've seen, we're not seeing, as far as government operations, we're not seeing insurmountable impact to our day-to-day operations. We're seeing it in some of our gas tax funds and obviously our bed tax and our sales tax collections, which will impact down the road. But we're really proud of a small business enterprise program that we've really launched in the last year or so that gets more of county dollars into county businesses. So in previous years, if we looked at how much contracts we had awarded out, it was a few $100,000s to local businesses, and now it's several $1 million to local businesses, just by educating our local businesses how to apply for to bid on projects and things like that. So we're really excited about that. I know that's not a direct answer, but that gets the money into local businesses, local employees. That all is part of the puzzle. But we've got to be diligent about going after federal and state grants, nonprofit grants from the big nationwides to get money in here, to spread around again to the local organizations like you all. And again, but if you're able to help, this is not some, business as usual, asking for money for a nonprofit charity kind of thing. This is serious. And if you're able to help, we need people to help.
So as Commissioner Justice said here, and I have to say that I have worked with the commission for the last 6 years, and I have never worked with a better group of men and women. And I've worked with a lot of commissions before, and these guys and ladies are determined to make Pinellas County better. So take it for what it's worth. think about it, and if you can do something to help your community, please do so. Again, we're with Charlie Justice and Commissioner, and thank you, Charlie. But I think before we cut this off, we're going to go take a little walk and look at something.
Sounds good.
Okay. So this is the second little part I said we were going to take a walk and look at. We're standing here at a brand new John Deere riding lawnmower and a wood chipper that chips up to 5 inches of wood size. And this was capable through the county commission, and it's the MSTU. And Charlie, could you tell us a little bit about what that is?
This is a grant program that we set up as a commission to support organizations in our unincorporated area of Pinellas County. We don't offer all the same services that are offered if you're in a city. So this is our way of supporting organizations and things that are going on in the unincorporated area of Pinellas.
So cool. So this is going to help us continue to mow the alleys and vacant yards and yards of senior citizens and families that can't do it themselves. And this is going to not only help cut down on the bulk going into the dumpsters that we do every Saturday. And, you know, we've hauled out over 1,500 tons of trash since we started this program in November of 2014. But this is going to cut down and save money also. So, Charlie, thank you, and thank the commission so much for approving our grant.
We are thrilled with the partnership with the Florida Dream Center and just so grateful for all the work you all do.
Thank you, sir.